approve the first order of business is to approve the minutes from the March meeting that were sent out on April 11th. So are there any additions, comments, corrections to those minutes? Hearing none, I'll move by unanimous consent that those minutes are approved.
Thank you, John. I did want to actually state before I go into the slide that we have two members who we haven't heard from before. They weren't here when we were introducing members back when they first joined, and that's Judith Bradley. I see she's on the call, and I also see Dr. Um, Armelsimo. I don't know if I said that correctly. Don't know if they want to unmute themselves and say a few words and just introduce themselves.
Yes, hello. My name is Armel Simo. You said it right. Just wanted to join to see how I could help and how to contribute. Thank you. So I work here in Catonsville. I have a little private clinic, and I also work for Mercy Hospital part-time.
Very good. Thank you so much.
Yes, thank you. Thank you for joining our group, Dr. Simu. And how about Judith? Judith, are you on the call and can introduce yourself?
Hi, it's Judith Bradley. I work with Aetna along with Chris, who's also on the call. It's just dialing in to listen. Thank you.
Okay, very good. Thank you.
All right. Thank you. Now, I did want to just give a quick recap of earlier this month, an event that we had. It's our second Broker Achievement Awards, where we recognize the top 100 brokers at MHBE. And this is the first year we've held this event in person, and we were thrilled that it was such a successful event. And so I just have some pictures on here on the slide for you all to see. On the left side of the screen is on, maybe it might be on your right side, I'm not sure, but is our top 4 brokers, and alongside Maria, our board member, Maria Pilar Rodriguez, who is our MHBE board member and our esteemed guest speaker at the event. Maria is also the president and executive director of NPR Business Solutions, LLC, a company that offers various services, including translation and consulting support services for small businesses. And she also holds the role of the executive director at the Maryland Hispanic Chamber of Commerce and was previously the executive director of the Maryland Hispanic Business Conference. She gave such an inspirational speech that resonated deeply with all of our attendees, and which set the tone for such a memorable afternoon and lunch event. So, and then as you can see, right there in the middle is Amber Hyde, who just recently joined SBPAC. By the way, she introduced herself at the last meeting, and she won the top broker in the small business category. And next to her on the left side is John Levine, who won the top broker in the BAT phones category, which most of you may not know what BAT phones are, but it's a program here where brokers accept live transfers from our call centers and assist consumers in completing enrollment applications. And this is his second year that he won this category. And then on the right side next to Michelle, there is our One Day Desalegn, who again is his second time as well, just like John, where he got the overall individual market category, the top broker category. And last but not least, Kimberly Dickinson was all the way on the far right, who is a standout because she was new to Maryland Health Connection within the first 2 years, and this is a new category that we had that we added for this year, and she had the most enrollments within the first 2 years amongst the other new brokers that just joined MHBE. Governor Westmore was unable to attend the event, but his office graciously provided us with proclamations and a video from the governor recognizing the top 4 brokers' achievements. And we were very grateful for that. So these brokers, a top 100, as well as these top 4, their dedication and expertise have not only earned them in recognition, but also contributed significantly to our mission of facilitating access to quality healthcare and reducing the number of uninsured in Maryland. And so we're very happy about this event. And congratulations again to all of the winners. And Amber, if you're on the call, great job, keep it up. Hopefully next year you give the other folks a nice competition.
Yeah, I also wanted to add just a shout out to Gene Poole, who was
Yeah.
the top group producer in 23 and remains one of the top producers in the exchange. And I know Gene is a regular on these calls, and his feedback and insights are always appreciated. Thank you, Gene.
Absolutely. Yes.
Thank you. Thank you so much for those kind words.
Yes. And then, so I'll just give you guys a quick update on this new enrollment portal that we have been working on since about April of 2023 and continuing and with some other updates. So I'd like to just focus on our vision and mission on this side because a few people have asked me, why does MHBE want to build a small business portal, enrollment portal? What value does it bring? And so by building this portal, our overall mission, and remember, MHBE as a whole has a mission to reduce the number of uninsured rates. And so we would like to contribute to that from this program's perspective into adding to that mission. And to do that, we set our target audience to small businesses with fewer than 10 employees, because the smallest of the small businesses are the ones who struggle to afford and access healthcare for their employees. Our enrollment goal is approximately 10 to 15,000 for the first 5 years post-launch of the portal. We also want to fulfill our statutory mandate to serve the small businesses in Maryland. And our plan, which is very imperative to this program, is to implement a robust marketing strategy pre-launch. And Teresa, who's my colleague, my counterpart in marketing, will be presenting on the marketing initiative for this program shortly. Any questions about our goals and vision and mission? All right, so I've shared this slide a couple of weeks ago with the carriers and thought it might be important to also bring it up here. We have a slightly updated integration timeline, and as well as the overall timeline I may have mentioned earlier. And we reviewed this with our carrier partners last week and believe we're still on target, but we're also pushed our billing and aggregation vendor onboarding to September 2024 instead of the originally anticipated July 2024. And so that pushed a few of our timelines back by a few weeks and months, but we're still hoping to stay on target for the launch. And our launch also has moved from May 2024 spring launch to a fall 2024. So we've just kind of pushed it slightly by a few months to just give us enough cushion time to accommodate certain things that, and we've encountered certain unforeseen circumstances, especially around the RFP, where we're working with the appropriate resources to resolve and get back everything back on track to launch in a timely fashion. Any questions about these timelines?
So Mimi, just a point of clarification, that would put the launch of the website itself as of like August 25. Is that correct?
Yeah, September 2025 is what we're
September.
anticipating. Yes,
Okay, thank you.
no problem. All right, just a few more updates about certain aspects of the portal because I've, in conversation with some folks, I've come across some questions, and some of the questions seem very obvious, but some are not very obvious to our audiences. So um, I'd like to just quickly provide an overview. And so on this side of the image that you're seeing here is exactly how the design of this portal looks, where the rules around plan selection is basically an employer or a broker can help an employer set up a benefit package that revolves around a single plan, which will not require a reference plan. And, or they could, it's not and or, but it's or an employer choice option where all plans from one insurance company, and the employer chooses one reference plan from that, or employee choice, which all plans from all insurance companies, but the employer chooses up to 2 consecutive metal tiers, such as gold and silver. And we've kind of talked about employee choice and employer choice in the past. So 2 consecutive metal tiers could be a gold and a silver plan, or a bronze and a silver plan. And then all insurance companies, we have about 4 insurance companies. All of those companies would be available to the employees to choose from those metal tiers and plans. And obviously, a reference plan would be selected with that option as well. So the only one that would not require a reference plan is when an employer chooses to just offer a single plan. Any questions around this slide?
Questions, folks?
All right. Moving on, minimum participation requirements.
I did have one
Um,
question.
I'm sorry. Yes, go ahead.
It does take a little time just for some of this stuff to sink
Yeah.
in. So go ahead.
Yeah. So in terms of the reimbursement programs that small employers have, you know, Casera and the other plans where they just pay a certain amount of money per month. Does any of that type of funding fit into this application that says, "Hey, we're going to pay $250 a month, no matter what it is per employee," or are those other choices kind of integrated into this software?
Good question, James. So is there the contribution plan all fit in to whatever selection that the employer has made, be it employee choice or employer choice? And then I assume there are screens that will allow that employer to set up the contribution schedules that they want and those sorts of compliance types of issues cross-checked. I mean, at some point in time, the employer is going to have a complete census information in there with all the employee elections to determine whether they can even move forward with a plan or not. Correct, Mimi?
Yes, and some of the conversation right now just was muffled a little bit. I didn't hear the full question and your response, John, but um,
I was thinking about the health reimbursement accounts primarily, all the options for health reimbursement. Whether they're paying a flat amount, because in the groups 10 and under, this is where you might find those options. And I'm thinking that from a compliance perspective, because they're going to have some sort of document that says that, hey, we pay a certain amount per month, or we're going to pay 50% of the individual rate, or we're going to pay. I'm just thinking about all the current things that are out there for funding. Should we not be integrating some of those features into the software package so this thing will automatically gin up the necessary compliance documents and puts the rules in place so that they can choose those options as well in terms of how it's going to be funded?
That's a very good point. What I can do is, and I don't really know exactly about whether we've accommodated for that, but I believe that might need to come from the broker's perspective, and that might have been the thought process. But let me go back and talk to folks. That's a very good point, Eugene. I'll bring that up and get back to you.
Thanks.
Yeah, I see Sandy has his hand up. Sandy? Sandy, I think you're on mute, Sandy.
Okay, now I'm in. Sorry about that. Do we have any idea the percentage of people that are taking these different options of, of choices that employer gives their employees, or what they're offering?
Well, right now we have a current enrollment of about 650 or so covered lives, and out of those, I don't have the exact breakdown. I can bring that for the next that analysis for the next meeting if that's necessary. But we don't have a lot of employee choice enrollments right now because a lot of it is under employer choice or a single plan, and that's because employee choice is just very difficult to enroll in for employees and also for employers to choose from. So
And
what
brokers, and brokers.
and brokers, of course, yeah.
Yeah.
And we anticipate that the take up would be, could be higher once we've simplified the enrollment process.
Okay, thank you very much.
Sure, Glenn?
Yeah, to Eugene's point, I mean, I think along the lines of like ICRA's and Coursera's, like he's saying, that knowing the numbers, like what people are going to contribute. But I think during the initial process, I think that selecting, either the employer choice or the employee choice. I agree, the employee choice is going to be extremely complicated, especially if you have age banded rates across the board, showing each person's, and trying to present that, to a group. It just makes it complex, and but then I think once that selection is made, and I would imagine 90%, and that's just my guess, between 80 to 90% of the groups are going to probably select an employer choice to keep it simplified, just because it becomes so complex. And then once that happens, I think at that point is where, if we're going to implement a contribution level, that's where it needs to sit, because, now you're adding another complexity up front, which challenges the whole conversation with the group that you're meeting with. We're discussing these things. So I think that's a very, very valid point. I just think it should be in the context of, like, I think a little bit in the latter part of the process, because as we all know, a small employer can not contribute at all if they wish not to contribute, but, in Maryland, but, they're not going to get anybody to buy unless they contribute something minimally.
Right. These are all very good points. But to Eugene's point earlier, I might have understood the question as if you were asking about HSA qualified traditional small group plans. But if you're asking about ICRA plans, right now our portal does not support ICRA plans and those compliance documents, but we're still in discussion about that as a future enhancement to the portal. And down the line, we may bring those back in and allow for another RFP process to integrate with an ICRA administrator.
I know you mentioned that before about having the ICRA administrator on board from the very beginning when we first had this conversation. It's just that all the brokers out here know that we see an employer has less than 10, we're not pushing them to get the group coverage. They have 10 or more, maybe they have a fighting chance, and especially have stable source of revenue. So, but if you want to have this particular segment to be successful, it looks like to me that the ICRA options, we may need them in play sooner than later, because that group of 1 to 10 is particularly financially volatile.
Right. I believe that's true, but what about for the folks that are saying the process to enroll in a traditional small group plan is difficult right now? And so I'm just posing the question that
Sure.
would
Yeah.
it be, wouldn't, I believe and what we anticipated was that to resolve this current issue of making enrollment easier for employers into traditional group plans, and then also adding that feature of ICRA and other, these are newer, they're not that new, but they're slightly newer features that have been brought up now. And so integrating those later into this new portal would probably, that's what was, behind our mission and our vision here.
Oh yeah, I mean, I'm not faulting you about anything about that. I'm just saying that.
It's feedback.
Yeah, exactly. I'm just giving you this feedback to saying, hey, look, these really small employers, there are two issues with them. One
Right.
is that the money that they make is not stable. So they say, even if I offer the program, my money is funny. I can't predict from when I have a lunch counter. I have a this. I can't even tell you when my people come to buy lunch. So
Right.
that's one problem. So when I mentioned the IFRA and other things and the funding mechanism that we have for the first 2 years for small employers, this is where I was trying to get back to the point of what are we going to do to make it easier so that they can actually afford it, not necessarily just the complexity of it all, but also if we want that under 10 market to be successful, it seems it becomes more urgent as to how do we offer a funding mechanism so that because that's what, more than the complexities, the funding mechanism that I find is the most difficult part for under 10.
Right. No, these are very good points. Thank you, Eugene. Taken, well noted. I did see Michael's hand up and he hasn't spoken yet. So let me go to Michael, and then Glenn, your hand is up as well. I'll get back to you as well.
Hey, Mimi. I actually put my hand down. It was in regard to Glenn's comment about his assumption for employer choice versus employee choice distribution. And I just wanted to say it was a pretty good swag from DC's data, DC shop data that they share with carriers. About 12% of their business is employee choice. The other 88 is employer choice. That's actually up from 8% last year. So we are seeing increasing employee choice. I'm not really sure what's driving it, but it is a trend so far.
Thank you for that information. Glenn, your hand is still up?
Yeah, that was just a very good educated guess, just because of, again, the complexity. So it's kind of interesting that I was pretty close to accuracy, even though I don't even sell in DC. But
Yeah.
But I think frankly, Eugene's point has merit to the point where only if it's kind of an educational piece, the way I would see it, to try to educate and have the complexities built in right from the get-go, because you have to remember when you sell a Coursera or a ICRA, you're basically selling an individual policy either on the exchange or off the exchange. And once you start complicating that issue, then you got to deal with, whether they're going to get subsidies, like what Eugene's referring to is, if they're going to get subsidies, then they lose the ability to have the function of the HRA to actually pay the premium. So that makes another complexity. So, I think the goal that you have here is really the initial layout goal is, okay, how do we ensure more small group Marylanders? Unfortunately, because of the pressure in the individual marketplace with the competitive premiums lower than the small group market, we're always going to be battling getting people to go into the small group market. However, a lot of my clients in my market space, they have saved the money. They're at a point where they do want to invest into the employee, into the benefit side, and realize that as a hiring situation, as opposed to these complications of ICRAs and Coursera's, where, I get Eugene's point that the money is where it breaks down. And if you're 10 to 15% lower in an individual product, then you're just building an HRA wrap around an individual product. So I think if we're still trying to do it as a small group, product 10 and below, I think the rollout is the correct method, and maybe just a little bullet point on the side that maybe your broker can discuss these other alternatives. That was my comments.
Yeah,
Thank you.
yeah. Of course, I think the majority of the smaller employers are almost best served by a single plan where it can be, because they don't want to do the administration on multiple plans, explain it to employees and the like. So I think really the employer selection will be really weighted towards just a single plan that they can use. And I think in some ways this gets to Eugene's point. There are additional services that can make that a lot easier. Think Section 125 plans, so contributions are pre-tax. Think of HRAs, flexible spending accounts, those sorts of things that are adjunct to the health plan and possibly mitigate some of the risk for employees. So there's a lot of ways to do it. That comes down to the technique of the advisor who is talking to out there marketing to the employers, as well as the system that is being developed by the exchange to actually take in that those decisions and pass them on to a carrier. So that would be kind of my perspective on it. Sandy, you have your hand up, so I'll let you chime in as well.
I don't have my hand up anymore. Oh, I didn't mean to. I guess didn't go off. I'm sorry.
Your opinion is always appreciated.
All right, so let's move along then. We have the in this dashboard, the employer's dashboard, during their open enrollment period, the employee and enrollments waiver section will appear, where it will show the number of employees enrolled, waived, and how many need to take action. That will be displayed on their dashboard, and this will be displayed until the group's open enrollment end date. There will also be a notify section for the employer to nudge their employees to complete their enrollments. And the employer can always access that employee management section from the dashboard to add or upload employees or remove them anytime from before or after creating their benefit package. So we're trying to make it as simple as possible for employers and brokers to administer it and manage the employee census. All right, so the crosswalk plans that we're looking at right now, and we've talked about this in the past, what crosswalk plans are. These are plans that are identified as similar or comparable to the existing plan for the employee or the employer. And in most markets right now, employers and employees are given the option to choose a new plan from the crosswalk plan options provided by the carrier. It's typically one, or it could be more than one plan, but I've seen mostly one offered plan as a crosswalk plan. Is someone trying to speak? Oh, go ahead, Glenn.
Yeah, I would just say that every year it seems like all the carriers are, they call it mapping over. So if you want to keep the language the same, you know what I mean, to make it like on the exchange, off the exchange, they call mapping over the plan, and basically the renewal is released, and they always change the deductible a couple $100 and change a few copays here and there. So they
Mhm.
offset the increase of the renewal. United's been doing it for years, and CareFirst kind of hopped on the bandwagon a couple of years ago. So Aetna I haven't seen yet a whole lot of distinction with that yet, but I'm sure it'll be coming.
Yeah, Glenn,
Thanks, Colonel.
that's what I've always called the double whammy. The insurance carrier changes the contract, the deductibles and those sorts of things, and they increase the pricing in the plan. So you've got a rate increase to deal with, plus the change in the benefits to communicate. One way or the other would be preferred, I think, from a stability standpoint. But that's the world we live in today, going from a $1,500 deductible to a $1,600 deductible to an $1,800 deductible, all within a 2-year period of time, is a little tough to communicate to employees when the rates are going up 8, 10, 12% a year.
And the big thing they have to include, which I guess I don't know if you're going to control that, if you're going to control the view of it, like CareFirst just puts like the plan, and the broker has to then create, the outlines of coverage and send both outlines of coverage. My suggestion would be to show the outline of coverage in a pop-up snapshot. Here's the new one snapshot. And, because it is it almost seems a little bit like a bait and switch. Here's your renewal. But oh, by the way, we have to tell them that now they're changing their deductibles and copay slightly, and out-of-pocket maximum. It's usually the out-of-pocket maximum and the deductible that should be highlighted.
Yep.
Gotcha. Good points. Thank you. I was just that helps transition to the next slide. This is basically what our notice would look like. We'll give them a notice, and we try to keep everything similar to what we've had on the individual side. Our notices would look similar. The terminologies usually stay the same, and so we use the terms and we've used that for years. So we're probably going to keep that, even though it's probably considered mapping on the off-exchange marketplace. But I believe it's pretty self-explanatory, and we'll probably provide like a glossary of some sort to make sure that we're defining everything that we're what we mean, at least. And so this is our what the renewal would look like, and a renewal notice would look like. And so this is how it would look like in the system. So it would tell the employer that this is your renewal plan, but this is the plan that you were on that's no longer offered, and here's the similar plan. Would you like to keep the similar plan? And they could be prompted to choose a new plan. Alternatively, in that same renewal time, if the employer will have the option to choose a different plan. Also, if they select auto renew, they will just be defaulted into that crosswalk plan. And so I believe this is what you were referring to, Glenn, where what's highlighted in that crosswalk plan should be, are you saying that there should be fewer things highlighted than what we have shown on the screen here? Or does this look okay, or any feedback on this? Glenn? That's okay. I think you might have a call or something.
I'm sorry, I stepped out for a second.
Gotcha.
Question?
I was saying if this is what you were referring to earlier about what should be highlighted when the plan is mapping or crosswalked into a new plan, that we're highlighting a few items here, like the total cost per month for the employee, and the total cost per month for the employer, and then all of the other items.
Yeah,
Should
I
it
agree
be
that
fewer?
it should be the key components. Yep, like that.
Gotcha.
Yep.
Okay. Michael, you have your hand up?
Do you have a slide that shows what the detail breakdown is? It has 2 hyperlinks below, down at the bottom there, details and see detailed monthly rate breakdown. Curious what the details are and what the monthly breakdown looks like.
I can get that for you and send that.
One of the, and the reason I'm asking, Mimi, one of the concerns we have as a carrier with DC Shop, and have been very vocal to DC Shop about trying to change this, is their inability to plug in carrier value adds, right? And a lot of those, and admittedly from the carrier side, a lot of those value adds are underutilized.
Right.
But we have value adds like that help remove financial obstacles, and there's no hoops to jump through for members that we see really low utilization on in DC specifically, because they don't call it out. We ask that the ask is, of course, that the brokers go out and explain this to their groups, but we're just not sure that that message is getting there. Everywhere else in the Mid-Atlantic, we see double the participation in that program than we do in DC. So I think it's important that, you know, if we're in the building phases and can still control what's being displayed, that information like that is being provided, so that members can make an informed decision.
Yeah, and you've brought this up in the past, and I've kind of taken it up with IT, and what we're doing is actually including a wellness link when they're at the quoting level, and when they can see those plan details for each carrier's plan. And so we've incorporated, well, we're in the process of incorporating that. I'm working with each carrier to add the wellness link within each plan details. So that's underway, and I believe we're looking at a July launch for that.
I'm
And we're
curious
going to
too,
incorporate that into our
and
current.
another reason is, you know, we have all these programs, we're spending all this money to become more member centric. And in an environment like Shop, where this information is not being conveyed to the customer who's looking at it right there in front of them, instead of listening to a broker proposal, that information gets lost sometimes in translation, even if the broker is communicating that to them. And we are under the assumption that the brokers are communicating, right?
Right.
Sometimes the customer's just looking at what's in front of them and taking that as this is gospel. You know, another one is vital meds, right? We offer a $0 copay on certain life-saving medications. If a member isn't aware of that, and they choose another plan where they now have additional cost burden to them to get those drugs that we're providing at no cost, they may have chosen differently if they knew about that program, right? And I know I sound like a billboard for United Healthcare right now. However, these are some of the obstacles that we face in the market with Shop and different, you know, DC HBX, and we're seeing tremendously, like, unbelievably low utilization of these types of programs compared to other markets within the Mid-Atlantic, and we can only chalk it up to one thing. So,
Can't you go to subscribers directly?
what's that?
Can't you go to members directly with information on those programs?
Generally speaking, brokers don't like us doing that. So we like, you know, John, you know, you may be the exception to that rule, but brokers like to control the communications between their customers and them. A lot of our mail gets either thrown into spam or thrown into the junk pile or just straight trashed. As a carrier, we have an incredibly low read rate. I don't think that's unique to us. I think that's a continued concern. The broker is a trusted resource. Shop is the platform that they're going through. So it should be, you know, that information should be provided, number one, ahead of time before the employee has to make a decision, because once they've made a decision, they can't switch.
Yeah, I got.
We reach out after the member has already been enrolled. So at that point, John, it's too late.
Yeah. Right, from a buying decision, correct. But from an uptake decision, it would seem that you could affect low utilization rates in your members by by some sort of direct communication, and you may have to co-opt a broker in the process. I don't know about that. I was one of those brokers that like to control that communication chain to keep my clients informed my way. And there are that is a proven way to maintain relationships. But there are new communication ways that may help facilitate some of those decisions. But thanks
Sure.
thanks for bringing that up, Mark. That's an important aspect. If there are special programs, how can they be communicated? In developing any kind of software program like this, there are limitations on the space that they can put with any particular offering or whatever, and then there's no guarantee that consumers are going to go to the effort of reading that stuff anyway. So,
Sure.
but it is a good point. It is a good point.
I was
Yeah, I
gonna
think
also add-
consumer education, when we have the opportunity to intervene, is going to be the most important work that we do.
Yeah.
Right.
I
As
was going
healthcare
to mention-
carriers and brokers. So, John, your point is well taken about boosting utilization. However, the education piece up front is critically important, especially when making a buying decision.
I understand. That's great. Thank you.
For the member communication or member education portion, Michael, I'm informed about MIA having these consumer education sessions, and they do it virtually. I know Teresa and her colleague participate in that, and maybe she could talk about that when we get to her section. But maybe taking advantage of these types of partnerships would be a good way to get your message across. But I see Glenn's hand is up, so go ahead, Glenn.
Yeah, to Michael's point, I mean, I used to work for United Healthcare, and the bottom line is I agree with what he's saying, that there should be a button for all carriers to have all their added value services. If the consumer wants to take a look at it, great. If they don't, that's great too. But I agree with him that, like even with my large groups, I'll send the full package, detailed information. I don't know if all my clients read all of that, but they need to at least be informed before they make their buying decision. And I think he's making a really good point for all the carriers and all the things that, like, Kaiser has their centers. They go to the centers and they get all these other, you know what I mean? So I think that way they can make the best educated decision, even though the broker wants to control it. So, yep, that's my comments.
Thanks, Glenn. All right, so let's
I had a question.
Oh yeah, go ahead.
Yeah, I'm kind of in between. Because these groups are so small, what I would say to Michael and anyone else has any updates is, as long as I'm given information as a broker about those changes, especially when it comes to formulary changes. If I get a notice, and oftentimes I'll get something from the carrier, they'll say, we're making these changes about in vitro fertilization or whatever it may be. As long as I get a 30-day notice ahead of time, I'm not against sending stuff out to the consumer, because they'll call me and say, hey, did you read this? And as long as I get it in advance, and I have it at least 30 days in advance, I would say at least, then at least I will be well informed to still control the messaging, because I think that the market is just so dynamic. And when you're down to 10, for me to speak to a group under 10, let me tell you, it takes a lot of resources to do that. But I don't want to hinder the information when all this information is out there in Google and everywhere else. People find out anyway. So I would rather do a hybrid where it says, hey, we're going to inform our brokers that this is what's going on. This is going to be going out to consumers a week of blah, 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 blah. And at least I have a fair fighting chance. So when they call me, I'm informed. That would be my approach to it, at least.
And Eugene, you said a hybrid approach. So that sounds a lot like our current model, where we educate the broker community. All I'm suggesting is we add that information in addition to continuing to educate the broker community about our products and our value adds and financial programs.
Yeah.
so the consumer can see it when they're in the system doing their own research.
Yeah, yeah. I
Is
mean,
that, is that the
yeah,
hybrid approach you're suggesting?
that's what I'm suggesting because
I just want to be clear.
the
Yep.
market is moving too quickly, and it gets to a point where even the broker can't keep up with all the changes. You know, but at least when we work in partnership with you, we have been given it. We can't say we didn't get it. You know, that's on us if we don't read it. You know, but at least if we're kind of working in partner, and that way I can always go back and say, well, I didn't read that memo. I'll go back and grab it. Oh yeah, here's what they're talking about. This is what they mean by blah blah blah. So I'm not in a bad position in that regard. It doesn't do much damage to me in that regard, just from my perspective.
Okay. Good discussion, everyone. Market updates, Mimi.
All right, market updates. Teresa, you're up. Let me know when you want me to navigate to the next slide.
Okay, thank you. Hi, thank you for having me today to update you on launching. It's a soft launch today for our online platform, Small Business. We're really excited when the time is right. Just like in real estate, location, location, location. Timing is everything when it comes to launching something this exciting and this important for our small businesses and our brokers. So I first wanted to start with our communication tools to promote small business, the video content. We have a video that is both in English and Spanish. That's MHC for Small Business. We will launch that on our social media channels such as YouTube, LinkedIn, really saturate the social media markets that we have, Facebook and Instagram, to go through the process. It's maybe a minute and a half long of the importance of having health insurance for your small business employees, as well as the benefits of having that. So we really are going to hit hard with the social media video content. We're also going to obviously talk about the tax credits that your business would potentially qualify for, how to get help with our broker community, which is vital, our partners at Free Help, and testimonials from our brokers and small businesses. We feel as if it's a powerful tool to use, having a testimony or share your story, so that other small businesses can see the benefits of having MHC for Small Business for their staff. Okay, you can go to the next slide, please. Testimonies that we have had from our small businesses. Thank you, Eugene, for your support last year. You were critical, and we really appreciate your time in locating some of our small businesses who have been successful through MHC for Small Business. And the Governor's Office of Small Minority Business Affairs asked that we provide them with an article of the success. So they take their magazines. It's a magazine that they send out. It's like their annual report. And they wanted to see how small businesses are, how they're doing. And so Eugene identified the Paycal, who's the office manager. We interviewed her and her husband, Germantown Allergy and Asthma. They were also on our social media network, as well as the magazine of expanding opportunities to the governor's office, and the Daily Record ran a story as well. Tamara Eskin, who is the owner of Conceptual Analytics. We had a wonderful day interviewing her, and her business grew tremendously from having health insurance for her employees, as well as Shelly Eldridge. We heard a personal reason as to why she left her business working for the state to start her own business, and how successful she was. Thank you for MHC for Small Business. So we're going to focus on testimonials through our broker community. Ask our brokers if they'd like to be a part of any kind of social media. We'd love to do that, having them and having the small business owner talk about, and their employees talk about, how having this new platform, this new application process, how successful it's going to be, how easy and streamlined it is. Okay, you can go to the next slide. Social media and testimonial strategies to target them will include Facebook, Instagram, LinkedIn, and YouTube. We will also, like, for example, this month we have posts on all of these social media channels for MHC for Small Business, National Small Business Month. So, you know, we're really going to target the small business owners to say, you know, here's some testimonials. Consider setting up an account on our new platform. Check it out, browse the website, and set up an account so you can connect with a broker, just start a dialogue with a broker. And then, of course, we will continue with our video content. We're at different types of conferences. I'd like to set up some webinars with some small business owners, connect them with a broker. And then, as I mentioned, we have our English and Spanish YouTube video that we'd like to project. Next slide, please. And then read all about it. We want to project a statewide marketing campaign that would include newspaper, radio, and television stations by sending out press releases and coordinating interviews with our executive director, Michelle Eberly, to talk about the importance of having health insurance, the importance of having this new platform, simplifying the platform for our small business community. So we will hold press events, and we will, I'd like to do them regionally once I'm able to identify share your stories and testimonials, and those little pockets, Southern Maryland, Western Maryland, Eastern Shore, Baltimore, all over the state, to get those local newspapers involved, and to start a newsletter as well. That's something that I've always wanted to do, to send out to electronic newsletter to send out to small businesses, just to give them updates as to how how they're doing, or if they want to get in touch with us, or tips and those types of things. So really and truly, that's what we'd have. This is a soft launch. We will have a more strategic, detailed marketing outreach plan as we get closer to the launch. But I just wanted to give you a light type of example of all the media that we're going to reach out to make sure that our small businesses are aware.
I'd like to add to, thank you, Teresa. This is great, because I'd like to add that we already do these marketing campaigns, everything that Teresa talked about on the individual side, and has contributed to the success of the individual platform. And also, one of the best ways to drum up business, to drum up the anticipation for this new portal launch, is Teresa herself. She goes out, and she already presented a few meetings ago about how the state partnerships that she works with, and she goes to these events, and there are hundreds of business owners there, and she constantly just talks to them and educates them and works with them and gets them the information. And I believe that's really and I get that feedback coming back, because sometimes these employers are like, well, how does this work? And how, I kind of get, the results of her hard work out in the field. So I think that's the real testimony here, is, the real hard work that Teresa does out in the field, and how that translates to folks who are interested in offering coverage to their employees. So with that, I'll just let anyone who has any questions for Teresa.
Thank you, Mimi. I appreciate that. I did want to add one more thing. We have this, I don't know if you can see, this need health insurance for your employees. This is a step-by-step process. We have resources that I hand out at these conferences and events, and send out whenever a small business owner needs some information. So we make the connections. We want to continue that communication with them. We want to make sure we reach out to statewide, whether it's at an event, outreach, could be a meeting that I attend, Latino community, the different chambers that I work with, just to provide them with resources. And then the next step would be for them to visit our website to get connected.
So if they connect to the website now, what happens? Are they looking for coverage, or what happens with a lead that you generate in the field now?
Well, a lot of times I tell them to go to the website and browse the website, because I don't want to overwhelm them too much with too much information. So browse the website, and they can click on find assistance, or set up an account. And it's just an easy set up an account with their basic information, then find assistance, put in their zip code, and then the brokers within their area will begin to pop up like a GPS. So
Yeah.
I kind of direct them to go ahead and, start a dialogue, just get the conversation started with a broker. And when they're ready, whether it's in the next 6 months or in the next year, to, start enrolling their employees.
Right. And I think you've been out to a few events with Eugene as well, right? And
Yes.
some of the other.
Yeah, we've had great experience going out together, and my hats are off to Teresa on that. It's been a good experience. We just got to continue doing it. A lot of people just don't know what's going on, and it's really just spreading the gospel, so to speak. And if we do that, we think we'll do okay.
Thank you. Thank you, Mimi.
Thanks, Teresa. All right. If there are no other questions for Teresa, we'll have a small business policy update, a quick update from Amelia. Oh, wait, before Amelia, let's, Glenn raised his hand. Go ahead, Glenn.
So I'm just kind of curious. I heard Eugene and Teresa go out and conduct some of these things. How do you, as a broker and agent, if you wanted to participate in this, not that I would have been available, but I mean, how are we selecting these opportunities, I guess, for people to educate the community with the broker available as well?
These small business targeted events that Teresa attends, when we have a broker go out with her, it's typically because they're the top broker. So last year, Eugene was the top broker in the small business category. So that was one of the perks that we give to these top brokers, is that when it's a market that they're interested in, or it's an event that they're interested in, we'll invite them out to attend that and table with us.
So the only curiosity is, with 800 and some subscribers altogether, the market certainly not that, nothing to downgrade or say, Eugene, fantastic job. But I mean, frankly, it's been out since 2014, and there's not a huge number of new members. So I guess what I'm saying is, I don't know if the top producer is maybe it might help some other brokers if they get involved or offer to get involved, then maybe they'll be educated and maybe start to promote the product. You know what I mean? And I'm not saying just for myself only. I'm just saying there might be some other brokers out there that may have wanted to participate or be involved, and not just to say the top producer, so to speak.
I think right now that's the starting point, and maybe down the line we may expand it to other types of programs, but it needs to be a fair, selection process. And I think that was one of the ways to make it a fair selection process, is to invite the top brokers out. But if you have any other suggestions as to how we can facilitate adding other brokers, we're all ears.
Okay.
All right, small business policy update from Amelia. Take it away.
Hi, everyone. Amelia here with the MHBE policy team. I'm going to give a quick update. MHBE is proposing two pretty straightforward regulatory updates to the MHC for small business functions, which we've previously discussed with this group, and I think both actually came out of direct discussions from the group. So really quickly, the two of them. First is a proposed update to reduce the employee minimum participation rate that an employer has to meet for SHOP eligibility to 60% uniformly. Current regulations vary slightly depending on whether a group offers plans under the employee choice model or the employer choice model, but is generally set at 75% right now. So this update would reduce the MPR to 60% from the current 75%. And the second proposed update is to reduce the waiting period that an employer may set for an employee from what's currently at 90 days maximum down to no more than 60 days, with the coverage effective the first of the month after the end of that wait period end date. The rationale for this one being a 90-day wait period, plus if there's any additional wait time for coverage to actually effectuate at the first of the next month, could end up amounting to up to 120 days of total wait time for a new employee's coverage to actually effectuate. So those are the two updates. We had discussed all these with SBPAC, as I mentioned, with carriers, with some other stakeholders who expressed comfort moving forward with these updates. We recently had an informal stakeholder comment period that lasted 30 days. It closed earlier this month, May 12th, and we just had a few comments from carriers just confirming again they're comfortable moving forward with these two proposed changes. Next slide. So update to that, it sounds like everyone's comfortable moving forward. So for next steps and just an overview of the timeline, we'll now take these two proposed items to the MHBE board at their upcoming June meeting later next month to vote to submit these two proposed regulatory updates for formal review. And then going through the whole formal review process, we expect that both these regulatory updates will be effective by October of this year. So that's it for the policy updates. If anyone has any questions, happy to take them.
Thanks, Amelia.
Discussion. So is this an open discussion, or is there further agenda items to be brought up for the group to discuss? Where do we stand on that, Mimi?
No, we've presented on almost everything that we've anticipated to, and if there are no other discussion items, we can move into the public comments.
Any other items from the committee during the discussion phase before we turn it over to public comment? Okay, hearing none, let's move to the public comment section of the meeting. Anyone from the public on the call wish to speak?
Hey, John. I know I'm not a member of the public, but I was trying to speak. I had my phone on mute, my mic on mute. I have one comment.
Okay.
I just want to remind us just to keep in mind that as we move toward the small group enhancements, that the carriers really set aside contact people that we brokers can actually work with. Because that's a big challenge right now. Based on the size of your organization, if you're a large brokerage firm, you might get more attention than the small broker group, because I'm having a lot of problems trying to reach the so-called shop division of some of these companies, and even down to the point of understanding who their participating doctors and hospitals are, because you'll get the macro presentation, but when we were on the selection for this past open season, there were many doctors' offices that said that they were accepting new patients, but the reality is that when you call the doctors' offices, heavy percentage of them were not accepting new patients under the shop programs or the individual programs. So, I think we need to have carriers kind of step up to the plate on this thing and say, listen, if it's shop or it's an individual group, these are our contact people if you're having difficulty. I don't see a strong showing there from the carrier perspective.
Okay. Thank you, Gene. Allison, you're the carrier perspective, I believe, aren't you? Allison, you're on mute with your hand raised. There you go.
Yes, Allison from Kaiser Permanente noted that comment, and we will be sure to incorporate that information into this new enhanced portal. But I really appreciate that perspective, and we want to make sure that you all are direct to the right folks to get your questions answered.
Allison, then I don't think he's referencing Kaiser in this.
Okay.
You're right, Brandon. It's the others.
He knows Jeff is his rep. So
Yeah.
Yeah, I mean, just for comment, after COVID, the industry has changed dramatically. We all know that. A lot of people are working from home. They're not having managers, supervisors over top. And, the customer service has really, in all aspects of it, have changed. And I agree with Eugene. If you want to do a good job, have brokers support the product, the carriers have to have designated representatives to. Now, are they going to have that isolated designated person? Most likely not. But, you don't want to be a broker that's a small broker like me, and you go to this, one carrier, you go and you're in the 800 hold number, as opposed to if you're, on the A team, you got a direct spot. But, it's all because the big brokers are gobbling up the small brokers. So yeah, I think Eugene's point's well taken.
Also, if Michael or Kathy, Michael UHC and Kathy Aetna, would you like to chime in on that? Or
Sure. So from UHC's perspective, we launched our new portal called UHC Services. And Gene, I'm not sure if you're referring to the individual side or the commercial side for UHC. On the commercial side, that's where I reside. We have UHC Services. We've provided a lot of trainings over the last 3 years on this platform, sent out email blasts with invites. And a lot of what you're probably looking to do, what you described, can be done through that portal or through myuhc.com, which allows you to do provider searches before a security wall. So if I encourage every broker to reach out to me personally if they are having issues getting basic information like you described, Gene, and we'll get you connected with the right people so that you can become trained up on those portals and grab the information you need at your place, not ours.
Yeah, I wanted to mention one thing, Michael. You mentioned that you're on the commercial side of it, but not just me, but I've spoken to a number of brokers where we have gone to the myuhc.com, looked up the groups, the shop groups or the individual programs and ACA programs that you have on the myuhc.com, found the doctors that are supposedly accepting the Affordable Care Act, and they say that they're accepting it. And then I tell the customer to do one more step. Call the doctor to see if that information on the website is current. I have customers that have gone to that site, gone to that process, and called as many as 8 different physicians, primary care physicians, who are not participating with UHC's program. And that it's not just me, it's a series of brokers that have had the same experience. So we need some representative from UHC to help us in the individual market. I don't know about the shop so much, but I do know that in the individual market, that has been a huge problem, because the people, they sign up for the program and they're locked in for the rest of the year. And they say, but I can't get my doctor. The doctors that are supposedly accepting patients are not accepting patients. Now, what do I do next, Mr. Poole? And I don't have anybody on the individual side that I can call at UHC that says, this is who we have. Our website has to be updated, or blah, 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 blah. We need a one-stop shop, because they keep putting us, we're being hung out to dry, and we're getting blamed for it because we're not getting the support we need to know for certain if that doctor's really participating in the ACA programs. That's where we're really having a lot of challenge.
Yeah, shoot me an email, Gene. I don't want to get bogged down in this space, but shoot me an email. I'll make sure you're connected with the right people on the individual side.
Can you put your email in the chat or something? Or thanks.
Yeah, Allison, you've got your hand up.
Yes. Hi, everyone. I put a question in the chat, but didn't hear a response. Is there a ballpark time frame when the ICHRA enhancement would be implemented? I know the shop enrollment platform is targeted for September 2025. Would the ICHRA enhancement be sometime after that time frame?
yes, it would be much after our portal launch, and after we get situated with this current system, it would be much after that would start looking at ICRAs again.
Okay, thank you.
Mhm.
And I wanted to offer Chris or Judith from CVS a chance to chime in as well if you'd like to address the comments from Eugene.
Yeah, this is Chris. I can answer. So we have a phone unit, the answer team that's specifically set up a direct line for brokers. They don't have to chase down their account rep, sales rep. They can just call right into this team and they can answer the overwhelming majority or help you with your questions. And if not, they can follow, research it, get back to you, and be accountable for it. So it's worked very well. We've had that in place for the past like 5 years or so. It's for a small group and middle market case sizes.
But the problem we're having has been the individual market. That's the one that we're really having the problem with.
You're having that with Aetna?
We're not with Aetna so much, but we're finding that just having a dedicated person to the individual ACA plans or the shop, we need to know who that person is that'll handle it from A to Z and not send us from department to department trying to resolve the issue.
So I'll just cut to the chase. It's and again, the 4 carriers in the market, unfortunately, Care First uses the TPAs, and the TPAs, we have to go to the TPAs, and we don't have a consumer health person.
Right.
When we do run into some major issues. So let's just say it how it is. I got to be honest. United Healthcare is good. Aetna's good. Kaiser, same. And I'm not trying to beat up the Blues. I'm just saying that's how it is.
Yeah, that's true. That is true.
And unfortunately, I don't think we have anyone from Care First on the line today, but that's fine. We'll take it back to them. But I do see Rita has her hand up and she has a lot of knowledge and expertise about this area. She's dealt with this for a while now.
Oh, I wish I had some additional input on that specifically. I was just chiming in if Eugene and Michael could please keep me in the loop on the issues with providers not accepting UHC ACA plans, because that's an item that we're tracking on our side as well. We've had a lot of feedback from brokers with regards to that.
Thank you.
Yeah, so Gene, if you included Rita in your email to me, we'll make sure you guys are connected with the right people. A lot of times what we find when a provider says they're not, or when a provider tells a member that they're not in our network, a lot of times the providers don't understand our different network options, especially on the individual side, because that's an emerging product for us in Maryland. I think we just entered the exchange a few years ago. So, we have a team of people that do provider education, and we do our best to reach out to every provider. However, there's turnover in those front offices sometimes, and those people may or may not be familiar with how to look it up in our systems. I'm not saying that sometimes our lookup isn't accurate. We unfortunately can't provide real-time data on that because network negotiations are always fluid, but we do our best to keep it updated within 24 hours of any changes. So again, Gene, send me that email, include Rita on it.
Will do. Thank you. Thank you very much. Will do.
Yeah, that's an interesting discussion on a problem that has existed since the development of networks, because you've got a three-way going. You got the consumer looking for something that's in the book. You've got a provider's office that may or may not understand their contracts and how that all works. And you've got a constant renewal process and recruiting process on the part of the carriers. So it's a very interesting discussion, and will be constantly changing the dynamic of networks and negotiated arrangements and those sorts of things. But might be a good topic to end on. Are there any other questions or comments, ideas, concerns to come before the committee today? Hearing none, I appreciate everybody's attending today. Rita, did you have, or Mimi, did you have anything else for the group?
I don't have much, but I just wanted to say that I would love to hear from the employer group, the employers in this group. I know Dr. Simo is new, but we'd love to hear your perspective on anything we've discussed or any challenges you've experienced, whether it's through your patients or your whether you're trying to offer coverage to your employees. Any feedback and how your first meeting went.
Yes, very interesting meeting, and I learned a lot. But the biggest thing for me, like most of my employees are mostly contractors. So the clinic, I don't know if how many clinics generate enough money to pay everybody, because my clinic is mostly just to help the underserved community. I started it to help the underserved community. So a lot of these insurance company, and I understood what somebody said about, a lot of physicians say, oh, we take this insurance, and then when the patients call, they say, oh yeah, we don't take them anymore. For some reason, it's because usually those insurance people don't pay, but I take everybody, whether the insurance pay or not, and then we just figure out what to do after. But with that type of model, usually you don't make enough money to pay everybody and offer health insurance. And I don't have up to 10 employees. So that was interesting to learn. I have maybe 3 to 4, at one time. So I'm, so I'm learning a lot from this. So I'll probably have more information later, because I'm going to use this information to analyze everything.
Absolutely. Thank you. I don't mean to put you on the spot, but that perspective really helps.
Yeah, we appreciate that feedback. Thank you, Doctor.
Thank you.
All right, then I guess we can wrap up, John. I think we're good.
Okay, well,
Nice discussion, everyone.
Thank you all. Be sure to read the minutes when they come out and make any corrections or additions to those minutes. It's also a good opportunity to put in writing back any comments that you think about after the meeting and say, oh, I forgot to bring that particular point up in that discussion or whatever. But appreciate everybody's time this afternoon. Thank you.
Thanks, everybody. And
Thank
by the
you.
way, we kept it to the hour and a half.
There you go.
All right.
Perfect.
Okay.
Thank you. Right.
Enjoy your day, everyone.
Bye.
Bye-bye.